Thanks for checking out this video. This video is entitled How to Manipulate Your Doctor into Helping You. And I feel a little sad that you're watching this video because I would hope that most doctors don't need to be manipulated into helping their patients. But I think there are some very important things that we should talk about in terms of having a really great encounter with your doctor. There are definitely some things that can make the process go more smoothly for you and for your doctor. You might title this video, How to Have a Great Interaction with Your Physician. This video is intended for anyone who has an appointment with their doctor. It's intended for anyone who may be bringing a friend or family member to the doctor to get some attention. And I hope that the tips in here will really help you have a great interaction the next time you need to see your doctor. The first thing that happens when you are going to see a doctor is some sort of referral process. There are two basic ways that you can be referred to your doctor. One is self-referral, where, for example, if you're going to see your family doctor, you may call them up and say, I need an appointment. The other way that you can get in to see a doctor is if you are referred by your physician to a specialist, then that's the other process. It's very important to be clear about the reason for referral. So when you're setting up an appointment for yourself with your doctor, it's important to pass along the information about why you intend to be there, because it will help your doctor prepare appropriately for whatever the visit is supposed to be about. It's also very important, I think, for you to know what the referral information that your physician passes along to a specialist is. I am amazed when I accept a referral from an emergency room doctor to admit a patient to hospital, how often the patients have no idea why we admitted them to hospital. They have an idea about why they came to the hospital in the first place, but often there's information missing in translation about the reason for admission. And so I think if it is possible for you to know exactly what's going on in that referral information, that's very important. If you have some time before your appointment, there are some things that you can do that will really help out the process. The first is, if you can summarize your medical history on one sheet of paper that you could provide to the doctor, that is extremely helpful. The information you want to put on that is displayed on the screen. Essentially, we want demographics. So, how old are you? Who are the important family members for you? Are you working? Are you retired? What did you do? Do you have health plan coverage? And then I think it's a really good exercise to write down in one sentence why you are coming to see the doctor on whatever day it is that you're seeing them. The other thing that's important to list is any previous medical or surgical issues. Again, short phrases, you don't need to put a huge amount of detail in there, but just a listing of things that have happened to you in your past history. A list of major life events with a date and then consequences. So for example, if you were in a major motor vehicle collision and sustained some ongoing injuries, that sort of thing, that would be important information to have. If you had a heart attack and then ended up with heart failure, a date when that initially started for you would be important. A list of medications is critical with the doses of the medications, when you started taking them, and if there have been any recent changes. That information is also extremely valuable. And then if you have a history of allergies or intolerances to medications or other things, as much detail as you can provide is very, very welcome and will certainly help your doctor do a better job for you. Doctors hate paperwork. Paperwork is increasingly a burden for us, and anything that you can do that would help with the paperwork burden would be more than appreciated. And certainly this is one way of allowing your doctor to have a bit more time to really attend to what you need from them. You've written down your medications, but here's the other thing. You need to bring them with you. You should bring all of your medications, all of your natural health products, all the vitamins, all the supplements, nutrients, basically anything that you take because you think it may have an impact on your health status. I would encourage you to actually take it. The doctor may ask for it, may not, but having it there is really important. The other thing I would encourage you to do is bring it in the packaging that you use. So if you take all your pills out of their bottles and dump them into a fishbowl, like one of my patients was doing, bring the fishbowl with all the meds in it. Whatever you do with your meds, bring that with you. The other thing is that some pharmacies now have apps that allow you to actually look at your medication refills. When was the last refill? How many pills did you pick up? That sort of information is also very helpful. So if you have the opportunity to get that information, that's really great as well. It's very important at the beginning of your appointment to be very clear about the goal. Is the goal of your appointment with your doctor to make a diagnosis, to figure out what's wrong? Is it to improve the symptoms that you have? Is it to improve function, allow you to live life better? Or is it to try to prevent negative outcomes in the future and prolong your life, more preventative type treatment? If you're very clear about what it is that you're looking for and you're able to communicate that effectively to your doctor, that will be extremely helpful. I'll give you two examples. One is statin prescribing. So the purpose of statin prescribing is really to prevent negative outcomes and prolong life. I have some patients that come in and they just want to feel better in the moment. And when I offer them a statin, I'm not meeting them where they're at. Statins are generally very well tolerated medications, but you can feel unwell in the moment. If you get some muscle discomfort, that sort of thing. It's a rare situation, but my reason for prescribing is really about the long-term outcome and not about the short-term. If a patient is really only concerned about the short-term, well then statin prescribing may not be appropriate in every circumstance. Another example would be opioid prescribing. If your goal is to function better, sometimes taking more opioid, which will control your symptoms, actually is counterproductive to improving function. And so if you and your doctor agree that really what you want to do is function better, sometimes even though you have pain, taking more opioids may not be the strategy that you want to use. And so being able to agree on what your goal is extremely important. In your conversation with your doctor, you want to find common ground and talk around that common ground. So the thing I would encourage you to consider is that you talk about best care possible. Your doctor will want to provide you with the best care possible, and you want to receive the best care possible. And so if you frame your conversation around how can I get the best care possible in this situation, then you'll be on common ground. And if you frame the goal that you're looking for around provision of best care possible, then that will really help you get through to actually achieving best care possible. You need to make a plan. So based on whatever it is that you decide to do after meeting with your doctor, you need to understand what are the most common beneficial effects you may see and what are the most common side effects or adverse effects that you may see. So for example, if you start a new medication, how long will it take for it to work well? So for example, you start an ACE inhibitor for high blood pressure. How long can you expect that it will take for your blood pressure to come down? If you're monitoring it with your home blood pressure monitor, what are the common things to look out for? So if you get a dry cough that's there continuously while taking an ACE inhibitor, then that's a problem, and you need to understand both the potential good things that are going to happen as well as the bad outcomes. If you can set some if-then scenarios up with your doctor, that's also very helpful. So for example, if I'm treating a patient with heart failure, I have an idea of how much fluid I want them to clear from their body each day, and we usually measure that by looking at their weight change over time. So we want you to drop 1 pound or half a kilogram a day. If you're not achieving that weight reduction, then what should you do? Generally, you want to increase the pills. If you're getting more weight reduction than you intended, what should you do? Reduce the pills. So if you can make some if-then scenarios with your doctor to try to help streamline care, that's very helpful. The other thing that you want to do is know when to bail out of whatever the plan is that you've established. So, at what point in the treatment process do you need to call your doctor? At what point in the treatment process do you need to stop the drug that you're trying out for the first time? At what point should you go to the emergency department if things are not going well? If you set up a system of steps in your care, when do you move from step 1 to step 2, that sort of thing. So if you can establish some of that with your doc, that's also very helpful. It's worth taking a minute to think about the relationship that you have with your doctor. One of the most important things is establishing trust in that relationship. And I would ask you to take a minute to think about whether you trust your doctor. If you do, that's great. It's important to communicate that to them. If you don't, it's also important to think about why you don't and what your doctor would need to do in order to gain your trust. And if there was a way that you could communicate this to them in a diplomatic way, I think that that's extremely helpful and will allow you to establish a more productive relationship with your physician. It's worth taking a moment to think about what your doctor's motivations are. I think that it is safe to assume that the fundamental value that drove your doctor to do what they do is that they want to provide the best care possible. I also think that doctors are pulled in 1,000 different directions, and it's important to think about the impact of this. So I would say that many of my interactions with patients are driven by exhaustion. And often when I'm seeing a patient, especially if it's towards the end of the day, by that point in the day, I'm sometimes thinking, just how can I get through the rest of this day? Paperwork is another huge problem for physicians, and it's important to think about the impact of whatever is happening on the paperwork burden. There's a lot of work that goes on behind the scenes after your doctor has spent time with you, and you'll notice now that with many of our electronic medical records, the doctor seems to be clicking away at the computer rather than talking to you. And so this is not a desirable situation either for you or for your doctor, but this has been forced upon us by the way our healthcare system is transitioning. And so it is worthwhile being aware of that as you're interacting with your doctor. The other thing to consider is how your doctor feels that they fit into the healthcare context that they are working in. So, who do they report to? What is their obligation in terms of how much testing they're allowed to do? Who's looking over the shoulder in terms of what kind of service they can provide? Who's keeping track of how many patients a day that they're seeing? And where do they fit into that? I think trying to be aware of what the expectations of your physician are within the system they work in is also an important thing when you're considering how best to interact with your doctor. A word about financial considerations. In some healthcare systems, the doctors are salaried, which is great. In others, it's fee for service. I work in a fee-for-service system where if I spend 5 minutes with a patient doing a follow-up visit, I get paid the same amount of money as I do if I end up spending an hour with a patient. And so in general, a patient who's having difficulty where I really need to spend more time with them, I'm actually losing money compared to those patients who are doing extremely well, which I guess you could say, well, that's an incentive for you to do a really great job with your patients so that they're all doing well. But the reality is that often when you are in the most need, the doctor is actually being compensated the least. And so, this isn't something that you can control, but it is something that you can be aware of as you interact with your physician. The final thing I will say in this video is that human decency goes a long ways. Human kindness, people respond well to that. Be nice to your doctor's support staff. When you initially call in for an appointment and you talk to an administrative assistant or a secretary, be kind. When you're talking to the nursing clinic, be kind. I think that just general human decency will get you a really long ways towards having a great interaction with your physician. I know most physicians really want to provide the best care possible to their patients. I hope this video has been helpful to you, and I look forward to posting more content. If you do like this video, please subscribe to this channel. If you have ideas about other things you'd like me to talk about, please leave a comment below. Thanks so much for being here today. Have a great day.
Dr. Dresser does not wish to take any responsibility for his opinions expressed in this video. Nothing in this video should be considered a therapeutic or diagnostic recommendation. If you are one of Dr. Dresser's patients and wish to be considered a good one, please adhere to everything in this video with religious fervor. If you are not one of Dr. Dresser's patients, please discuss these ideas with your healthcare provider.